Welcome dentists, cysts of the jaws. In this module, we will learn how to identify and differentiate the most common jaw cysts, just like a radiology detective. First, let's look at the most common cysts found in the jaws. The radicular cyst is the most common jaw cyst. It is always associated with the apex of a non-vital tooth and appears as a well-defined radiolucency on radiographs. The dentigerous cyst forms around the crown of an impacted tooth. It is most commonly seen around impacted third molars and may cause displacement of adjacent teeth. The Odontogenic Keratocyst, also known as OKC, is considered the most aggressive of these cysts and has a high recurrence rate after treatment. Radiographically, these cysts have characteristic appearances. A radicular cyst appears as a well-defined radiolucent area at the apex of a non-vital tooth. A dentigerous cyst appears as a well-defined radiolucency surrounding the crown of an impacted tooth. An odontogenic keratocyst commonly appears in the posterior mandible and may present as either a unilocular or multilocular radiolucency with smooth or scalloped borders. Now let's review some important exam tips. The most common jaw cyst is the radicular cyst. The cyst associated with impacted teeth is the dentigerous cyst. The most aggressive cyst among these is the odontogenic keratocyst. Another important concept in radiology is the difference between unilocular and multilocular lesions. A unilocular lesion has a single cavity and is usually less aggressive. A multilocular lesion contains multiple compartments and may indicate more aggressive growth, such as in odontogenic keratocysts or ameloblastoma. To remember these cysts easily, use the mnemonic RDO. R stands for radicular cysts, the most common. D stands for dentigerous cyst, associated with impacted teeth. O stands for Odontogenic Keratocyst, the most aggressive and prone to recurrence. In summary, the radicular cyst is the most common and occurs at the apex of a non-vital tooth. The dentigerous cyst surrounds the crown of an impacted tooth. The odontogenic keratocyst is aggressive and has a high recurrence rate. Understanding their radiographic appearance and location helps in accurate diagnosis.